So I probably see 5 or 6 guys a week with pain in one or both testicles. Let's talk about why this happens and let's talk about what you can do to fix it. Stay tuned. Dr. Segal here. So the question is, of all places to ache, why do my testicles hurt? Okay. And at the end, guys, I will tell you kind of the one situation where you really don't want to ignore pain in the scrotum. So make sure you stay tuned to the end to get that pearl of wisdom. So it is actually one of the more common kind of chief complaints that we get from patients on a weekly basis. I would say I see 5 or 6 guys a week with this problem. Now, sometimes it is a true anatomic abnormality. So if we circle the testicle here, and I'm just going to say that that whole black area is the scrotum. There are swelling entities of the scrotum and the scrotal contents that can cause discomfort. So this structure above the testicle is called the epididymis. It can get a cyst. That cyst is called a spermatocele. That can hurt, okay? And we have a whole video on kind of lumps and bumps in the scrotum, so check that out. This sac around the testicle, the scrotum, can collect fluid. That's called a hydrocele. That can hurt. An infection of the wall of the scrotum or just inside the scrotum called an abscess, that can hurt, and that's actually something that we have to drain with a procedure. So that's a big deal to get treatment for that and to get attention for that. I have seen tumors of the testicle cause pain. They usually don't, though, okay, for what it's worth, but they can. The testicle obviously has a blood supply that goes to the abdomen. Okay, that blood supply can get dilated or swollen. That's called a varicocele. That can be painful. Okay, I would say sometimes upwards of 10 to 15% of men have a varicocele. A collection of sperm in the testicle after a vasectomy. So when we cut the vas deferens during a vasectomy, that sperm somewhere has nowhere to go, and that collection of sperm will feel like a knot in there. That can be painful. Okay, so that's another reason why. Cysts of the scrotum, prominent blood vessels in the scrotum, if they burst, they can be painful as well. An infection of the testicle and the structure above the testicle, the epididymis, this is called epididymo-orchitis. That can certainly be painful. And also a hernia. Remember, the scrotum can be connected to the abdomen with kind of an open patent area. And if contents from the abdomen go into the scrotum, that's a hernia, and that can be painful, all right? Now, having said all that, those are anatomic reasons why you can certainly have pain in the scrotum and the testicle and ache. I would say a large number of individuals that we see with this problem don't have any of these things. And it's very frustrating for them, and it can be frustrating for us too. So we've done ultrasounds, we've done a good exam. We don't detect any of those lumps and bumps that can cause discomfort, and they still have discomfort. Now, people say, why do I have this pain if I don't have an anatomic reason for it? We don't always have a good answer for that, and I tell guys that for sure. Sometimes they may have had an infection and didn't know it, and the resultant inflammation in the area can cause pain. The way we oftentimes deal with it is this idea that we want to break the pain cycle, right? We want to break the cycle if you're having so much pain in the testicles. And sometimes when we break the pain cycle, get rid of the pain, it doesn't come back for whatever reasons. The algorithm or the way that we break this pain cycle is as follows. So we recommend oftentimes non-steroidal anti-inflammatory drugs like Motrin, Aleve, naproxen, etc., and try those intermittently. Warm compresses, cold compresses, scrotal support. So that's a big one. So wearing like really tight briefs, even wearing a jock strap, anything that holds the scrotum closer to the body can improve the discomfort with in the scrotum and testicles, and that can break the acute pain cycle. So try that as well. If none of those things work, we do sometimes consider antibiotic trials to eradicate any small amount of bacteria that may be in there causing discomfort. So that's a possibility too. And we can even do injections of the spermatic cord, which is the structure that leads to the testicle that does have nerve fibers in it. Now that's less common, but that's another thing that can be done. This kind of brings me to my pearl of wisdom. The one thing I want you guys to not ignore, okay? Don't ignore if you have acute pain in the scrotum, okay? There are a few things that are emergencies, things that if they call me for, I am getting out of bed in the middle of the night to fix, because acute pain can indicate something that is truly an emergency, okay? Specifically, twisting the testicle, okay? That's called testicular torsion. So for whatever reason, and there's a lot of different reasons for it, but the blood supplied to the testicle will twist. And when that twists, it can get cut off. So the blood supply gets cut off to the testicle, okay? That testicle will then start to show signs of actually dying. And when that happens, you'll have excruciating pain in the testicle, and it can even travel up all the way to the abdomen, because remember, those nerve fibers go all the way to the abdomen. So testicular torsion is a reason for acute pain in the scrotum. An abscess, all right, so a collection of infected fluid there, can be very painful and come on in an acute setting. And the treatment for that is to drain it, which we do, and antibiotics. So that's an emergency as well. And the final thing is something called testicular rupture. So if the testicle actually breaks, now that's secondary or because of a trauma typically to the testicle. So classic idea is a guy's playing baseball with his kids, that baseball hits him right down there, and then the testicle can rupture. Now that's something where we fix in an emergent fashion as well. We have to physically sew it up. Obviously you're asleep for that, but what I mean to say is that's an emergency. So I hope that gives you guys some way of thinking about kind of acute scrotal pain, chronic scrotal pain, how we deal with it, how we think about it. Thank you so much for listening. We certainly appreciate it. Please subscribe to our channel. We release new videos every week. Thanks again, guys.